Okay, so I'm in the ER, I'm looking at the patient's chart, making sure, I'm looking at the order, making sure it's the right patient. I'm making sure they have no allergies. I'm gathering all of my supplies for her catheter. And now I'm gonna go into the room with my supplies. And hi, Mrs. Jones. I'm here for your catheter, and I'm just gonna give some privacy and sanitize my hands. If you could just tell me your name and date of birth. I'm just gonna check that right here. Perfect. And do you have any allergies? Okay, you don't. I'm just gonna raise this bed. So good working height. Okay, and I'm gonna be giving you a catheter. The doctor wants to keep track of your input and output, if that's okay. And I'm just gonna pull this up. And did you need a third person in here at all? Okay, you don't. All right, just gonna place this under you. Okay, get this up. I'm just going to place this under you. Shine side down. Okay.
I don't want it. Uh-huh.
Okay. Gloves. And I'm just connecting this. This will be to inflate the balloon after it's inserted in the patient. I'm now going to bring my supplies over, and I have the povidone iodine. I'm going to put this on. Okay, now we're going to clean off the patient with the povidone iodine, and I'm going to wipe one side and then throw it out, and then the second side, throw it out, and then down the middle and throw that out. Okay. And then we're going to lube up the tip of the catheter. I'm going to start to insert the catheter. I'm going to insert it and insert it. And then once I see some urine, then I'm going to insert it another 2 inches. Okay. And then I'm going to fill up, inflate the balloon. And hold that down while I take it off and then throw that out. Okay, and then there'll be a little bit, make sure, check if there's a little bit of resistance, not to tug too hard. Okay, and I'm going to place this on the bed, not on the bedroll, I'm going to put it on the middle part. Okay. And then give this a little bit of slack. And then place this on the patient's thigh with a little bit of slack so when they're moving it doesn't hurt them. Okay? And throw that away. And I will remove this and throw that out. Okay. Right, and then ask the patient if they needed anything. I would lower the bed. And make sure that they have their call light. And I'm going to throw everything away, sanitize my hands, and then document.